Thank you, Lisa, for talking a little bit about diabetes. I now want to go into diabetes and cardiovascular disease. So to start off, a little anatomy about the cardiovascular system. It consists of heart and blood vessels, including veins, capillaries, and arteries, and it basically allows the heart to pump blood effectively to tissues and organs, which includes hydration to tissues, removing metabolic waste, and delivery of oxygen and nutrients to tissues and organs. This is important to understand because one of the leading causes of death in people with diabetes, predominantly type 2, is cardiovascular disease. Okay? And this occurs with a combination of hypertension and diabetes, which can definitely be lethal because it increases your risk for heart attack or stroke, okay? And this occurs at a cellular level where insulin resistance is responsible for the hypertension. So an impaired cellular response occurs and it predisposes an individual to having an increase in vascular smooth muscle tone, which is a hallmark for hypertension. So over time, an increased blood glucose or hyperglycemia can damage muscle, it can damage nerves and vessels, all that are responsible for controlling the heart. It can cause vascular remodeling, okay, which can also lead to atherosclerosis or plaque buildup, which can lead to cardiovascular disease. This can also happen in the brain, which can lead to stroke, okay? And hyperglycemia can also damage the kidneys and cause you to go blind as well over time. Hypoglycemia, on the other hand, or a decreased blood glucose, activates our autonomic nervous system, which increases inflammation, atherogenesis, and increases blood pressure, okay? So this is bad over time as well, too. It can also lead to certain dysrhythmias that can potentially be deadly, okay? I now want to pass the presentation off to Jin, who's going to speak a little bit about clinical reminders and alerts and further our presentation.